want to get my glasses removed, but which procedure will be best suited to me? Whether I should go for PRK or should I go for LASIK? Hello and welcome to CFS. I'm Dr. Kanika Bharadwaj and today I will be answering these questions for you. So, what does PRK stand for? PRK stands for photorefractive keratectomy, whereas LASIK stands for laser-assisted in situ keratomelusis. Essentially, both of these procedures shape your cornea in order to help you focus light better without the dependence of glasses. However, there is a big difference in PRK and LASIK. While PRK does not involve the formation of a flap, LASIK involves the formation of a flap. And flap is basically a corneal tissue which is lifted up from the cornea surface in order to facilitate good healing. When we come to healing, this is another big important difference between LASIK and PRK. The recovery time from a PRK procedure can take up to 3 days because the surface is scraped off and hence it needs to grow back on its own in another 72 hours. Whereas after LASIK, the flap is repositioned at the same sitting and therefore the recovery time is reduced to less than 24 hours. Apart from the procedure and the healing time, another main important factor which determines whether you are suitable for PRK or LASIK is what is your corneal thickness. According to your prescription, if your corneal thickness is not sufficient, then a surface procedure like PRK is better suited for you instead of a flap procedure like LASIK. Another major difference where we prefer PRK is in certain professions that do not require any corneal scarring, such as those people who have been applying for armed forces or who have been applying for pilot jobs. There, they are not allowed to have any kind of corneal abnormality as well as any kind of corneal scars. LASIK, being a flap procedure, makes a 22mm cut on the cornea, and during the healing process, microscopically, the cut can be seen. Therefore, PRK or surface ablation is more preferred in fields such as armed forces and people who are going to be applying for pilot jobs. One big difference with PRK and LASIK is also the healing process. The healing process in PRK is a little bit slow and the recovery takes more time as compared to LASIK. The dryness is also comparable in both the cases, but sometimes PRK does have a little element of haze depending upon the number that is corrected. The haze issue is not seen with LASIK. However, LASIK can have its own set of complications. Before deciding for any procedure, it would be advised to go and check with your ophthalmologist and only then come to a conclusion as to which procedure you should go forward with. There are different types of LASIK procedures that are available at the present time. Initially, in the earlier times, we used to have blade LASIK, where the flap was made with the help of a blade. Of course, the mechanical problems and the blade-related issues were the things that prompted us to find a better solution, and there came femtosecond laser-assisted flap LASIK. In the present times, a femtosecond laser-assisted flap is the preferred flap over a blade LASIK flap. There are also other procedures which fall under the LASIK umbrella, such as wavefront LASIK, wavefront optimized LASIK, wavefront customized LASIK, topography guided LASIK, and even contour LASIK for that matter is also a flap procedure. Most people think that PRK or the surface ablation, being a first generation procedure, is not safe, and LASIK is a safer alternative. Let me make it clear to you. Both procedures are safe. However, if we were to compare, LASIK being a flap-related surgery, the flap complications do exist, and comparatively, a surface ablation or PRK gives you a better surface stability. Hence, that is why PRK is preferred for people who are more into adventure sports and such professions which may require a lot of physical contact close to their face. So what are the common things between PRK and LASIK? Both of these procedures can correct spectacle independence, which is the plus power of hyperopia up to 5 diopters, the minus power of myopia up to 10 diopters, and the astigmatism or the cylindrical error in your refraction up to 5 diopters. Both of these procedures are safe, they both have good visual outcomes, and both of these procedures can be advised for anyone who has a good corneal test report, can be done in the same sitting in both the eyes, and the recovery and the treatment profile after the surgery remain the same. So, if you ask me which procedure is safe, hence in comparison, PRK is a safer surgery. But then why is PRK not as popular as LASIK? The answer to this question is because of the slower recovery time. Like I said before, PRK requires up to 72 hours of recovery time when the top layer regenerates by itself. Because of the slower recovery, PRK is now losing its popularity. However, safety-wise, surface ablation or PRK is still better to LASIK. While PRK was the initial procedure that was done for refractive corrections, LASIK is generally a newer technology considering PRK. The excimer laser, however, is the same in both the procedures. PRK being a first generation procedure, LASIK is a second generation procedure, and the more advanced lenticule procedures such as SILK and SMILE are the latest versions. So all of you who are confused whether you have to get PRK done or LASIK done, please come to your nearest ophthalmology center, get your eyes assessed, and let the ophthalmologist or refractive surgeon decide which is the best procedure for you.
Follow Planet LASIK and post your queries to get answers from the experts.